Good morning. It is indeed a pleasure for me to address you and to speak to you on a topic that we don't hear much about. Oftentimes, emphasis is placed on communicable diseases such as the recent chikungunya outbreak that I'm sure that most of us or all of us have heard about. Also, emphasis is placed on non-communicable diseases such as diabetes, hypertension, cancers, etc., because these are the leading causes of death in St. Vincent and the Grenadines, and of course they require our attention and we speak about them. However, we don't hear much about our eye health and about the emphasis that we should place on eye and on eye health. As the moderator said, the eyes are the windows to the world, and without our eyes then we cannot see what's happening around us. So it's very important that we emphasize or take some time to understand the importance of our eyes. Eye health is very important, is a very important issue that has not received attention it deserves in developing countries. This is particularly due to a lack of trained eye health professionals in developing countries, and when we speak about developing countries, we're speaking about countries like St. Vincent and the Grenadines. So a lack of eye health professionals, lack of ophthalmologists, optometrists, etc. The high cost associated with eye care and eye health, and the perception that problems of the eyes are not as important as problems of other parts of the body. Eye health and eye care must be addressed because failing to do so can impact individuals in many ways. It is therefore commendable that Ports St. Vincent have decided to extend its services by opening this eye center, what is called Ports Optical, in order to offer a range of services to improve eye care and eye health in St. Vincent and the Grenadines. Low vision and blindness have dire effects on individuals, families, and on communities. These effects range from a decrease in the quality of life and increased mortality. When we speak of mortality, we're speaking about deaths, to large-scale economic consequences on these individuals. For instance, if you cannot see, or you cannot see properly, then you cannot learn properly, and we're sure that those who are teachers and those who have taught know that when students cannot see properly, then their learning is affected. If you cannot see properly also, then you cannot perform your work adequately, and if you cannot see properly, then you're at danger because you put yourself in harm's way and without even realizing that you're in harm's way. Culturally, there is often a stigma associated with blindness, further alienating the afflicted from their communities. Social disadvantages are also enormous. For example, 50% of the blind in less developed countries report a loss of social standing and decision-making authority, and 80% of blind women note a loss in authority within their families. So it's very important that maintaining your vision and being able to see is looked at as an important thing, because once your vision has deteriorated or once you cannot see properly, then it is associated with a loss in your social standing. Fortunately, there is hope, and we can reverse these devastating impacts as long as the medical community continue to increase access to eye care and to eye surgery. So with the opening of this center, Vincentian will now have access to free comprehensive eye examinations, referral of any detectable eye conditions that cannot be handled by the center, and affordable eye equipment such as glasses, contact lenses, and sunglasses. The impact of blindness and eye problems on quality of life is particularly alarming for people in developing countries, and and countries like St. Vincent and the Grenadines. Approximately 45 million people in the world are blind, and 87% of the visually impaired people live in developing countries such as St. Vincent and the Grenadines. And the economic consequences of blinding they're staggering, as 90% of blind individuals cannot walk. So because of visual problems, because you cannot see, or because you cannot see adequately, then you cannot walk, and because you cannot walk, then you cannot provide for your family. So it's very important that the eye is looked on as an organ that requires adequate attention. For example, poverty and blindness are believed to be intimately linked, with poverty predisposing to blindness and blindness increasing your risk of poverty by limiting employment opportunities and by incurring high treatment costs. With affordable eye care and easy access to eye care, individuals do not have to wait until whatever eye problems they have worsened to seek attention. They are afforded free examinations and various affordable payments options, I've been told, so that they can come in, they can get their eyes examined, and then they can walk out with a team of codes how best they can pay for their glasses. So they don't have to wait until they come up with their thousands of dollars. As we know, glasses are very expensive, and so if you've been detected with an eye problem, then you can come to see them. I've been told that it is free of cost. So you walk in and you say you want your eyes to be examined. They look at your eyes and they say you need glasses. Then you don't have to say, okay, I have to save up X dollars every month for 6 or 7 months until I get my glasses. They can give it to you right away, and then you can pay little by little. As you know, most of us know the tradition with codes that you can pay little by little and so forth. I'm sure that you've taken your fridge, your stove, your whatever, and you've paid little by little. So it's the same, I've been told, with the glasses. So it's very important that as we speak universal health care, and I'm sure that most of you have heard this terminology, universal health care, it must be noted that financing health care and paying high out-of-pocket expenses for health is a barrier that prevents individuals from seeking medical attention early. However, early screening and early detection and early treatment of any health problem is far more beneficial than doing so when the problem has gone too far, as we will say locally, or when there are complications of this problem. Although eye problems and blindness are not typically recognized as killer diseases or problems that will kill you right away, blindness does lead to increased mortality. As I said earlier, when you're blind, when you have eye problems, you put yourself in harm's way and you don't even realize. So it's very important that these windows to the wall, as our moderator said earlier, is kept clean and open so you can see the wall and you can protect yourself. Though blindness may temporarily trap individuals in poverty, health interventions have potentials to help the blind and their family improve their socio-economic status. Many diseases carry blindness as a complication. For example, patients who are diabetics can suffer from diabetic retinopathy, so the diabetic patient you need to get your eyes checked. Patients who are hypertensive also need to do routine eye examinations because they're the risk of glaucoma because of the increase in pressure. So you need to get your eyes checked, you need to get the pressure of your eyes checked, because if these are not checked, then you can suffer the complications, which is blindness. So these patients can have their eye tested, and any abnormalities detected, the optometrist can refer them accordingly to the ophthalmologist. And by having your eyes checked regular, you can avoid blindness and thus be able to perform your daily duties. We cannot speak about eye. And when we speak about eyes, we generally will talk about adults, and we generally will think we're speaking about old people. However, we cannot speak about eyes and exclude the children. Parents are encouraged to look for signs that that may show that all may not do well with the vision of their children. It's very important that you do this, because by detecting any signs that may show you that your child is not seeing too well, there may be some problem with your child seeing, then you can seek early medical attention. You can have your child's eye checked early. You can have your child be screened and treated if necessary, because these disabilities can have significant implications on the growth and the development of your children. So when we're speaking about eye care, we're not only speaking about adults, we're not only speaking about old people that their vision is decreased, but we're also speaking about protecting the vision of your children so that they can grow and develop properly. If they can't see properly, then they can learn properly. So it's very important that we do this. So it is critical that public health programs focus on preventing blindness, as eye care interventions can have incredible economic and social returns and can dramatically improve the quality of life for individuals with eye problems and improve the quality of life for their families. So in concluding, let me congratulate Port St. Vincent for taking this brave or bold step. As Michelle said earlier, not Michelle, but the gentleman said earlier that people will wonder what is sports doing in the business of eyes, glasses, etc. But it is important that options are created for individuals so that they can have access to health care and access to eye care. As we know, there are lots of barriers where eye care is concerned. Cost being one of them, very, very important factor. And so with this center, I'm sure that more people will come to get their eyes checked and get the screening that are necessary in order to prevent blindness and other complications of the eyes. Thank you very much.